Hi, I'm Dr. Katie Foss, author of Constructing the Outbreak, Epidemics in Media and Collective Memory. I'm a professor of media studies in the School of Journalism and Strategic Media at Middle Tennessee State University. Today I'll be talking to you about covering pandemics, past and present, thinking about the parallels between media coverage of epidemics in the past to our current crisis situation. If we look at the role of media in various epidemics, we can identify 5 functions of media at these times, from updating and educating the public to documenting and preserving the moment. Updating and educating people has always been a staple part of news, but this becomes even more critical during an epidemic, from identifying and conveying the first cases, to announcing deaths, unfortunately, to mandating quarantine. Media have played a critical role, letting people know about treatment facilities like we see here for this hospital for tuberculosis patients in 1888. We can also think about how media serve as a role from the first cases all the way through moments of triumph, both with cases dwindling as well as the victory of discovering a vaccine conveyed in this iconic photo. And media help educate the public on what's going on and how to prevent disease. As we see here from this public health poster that warns people about the danger of spitting, to this 1952 polio precautions that lists various things that kids are not supposed to do and what they're supposed to do to prevent polio. So what does this look like in our current landscape? Well, we can think about how we have so many sources that instantly provide us with information, both at a local level as well as a national and international level. We also have a lot more choices of media platforms, but the function is consistent, both in providing information as well as educating the public on how best to wash your hands and other precautions. Media outlets also serve as spaces for public debate. And a great example of this is in 1721, when James Franklin, brother of Benjamin Franklin, started his newspaper, the New England Courant, as a space to oppose the practice of inoculation. Inoculation is the practice in which you intentionally infect yourself with smallpox in the hopes that you receive a mild case versus a severe case. This is especially important because there was a raging smallpox epidemic in Boston at that time. Now, the New England Courant didn't just stay on issues of inoculation, but it set the stage for further types of debate in colonial America. Similarly, we can think about the role of the Federal Gazette during the 1793 yellow fever epidemic in Philadelphia. Physicians as well as individual citizens used Andrew Brown's paper in order to debate the origin of the yellow fever epidemic, possible means of transmission, as well as suggesting remedies that people could try. Similarly, we saw a lot of debate about tuberculosis after Dr. Robert Koch confirmed that it was indeed contagious and not hereditary as people believed. So there was much debate about what to do with people who were infected with tuberculosis, and we saw the newspapers play a vital role in the rise of the sanitarium movement. So what does this look like now? Well, we certainly have a lot of social media platforms that allow for debate. And we can think about the clusters of issues that are being debated right now. What jobs are considered essential, for example? What business should be open? What's the role of comedy? And is it okay to make jokes at such a critical time? Of course, on a daily basis, we see issues about the economy arise. And at the same time, with the mass transition from in-person teaching to online teaching, we've seen a lot of discussion about how to teach online and what the best means of doing so is. We've also seen for the K through 12 crowd, as parents are unexpectedly having to run homeschools for their children because they're out of school. Media outlets have always allowed us to connect with others. Now, this was a lot more difficult at a time with only print, but people would take out announcements or take out ads in newspapers in order to convey information to their fellow citizens. For example, Thomas Phillips took out this announcement in the Boston Gazette in 1721 in order to challenge a rumor that his family had smallpox. Announced that he, of course, did not have smallpox, nor is it in his house. people used to write a lot more letters, and this was a way to connect with people individually, but we also saw these letters published so that other people could read them as well. For example, we see Alexander Hamilton's letter in the Federal Gazette announcing that he is now a survivor of yellow fever and that the disease is behind him. We also see a reprint of Dr. John Inglis's letter to the Journal of American Medical Association, in which he talks about the stigma about tuberculosis patients. And this was reprinted in the Colorado Springs Gazette. Right? We can think about the vital role of letters in preserving the moment as well, as we see here from a chemistry professor who wrote a letter to his friend during the 1918 influenza pandemic. In addition to thinking about how media can serve as an outlet for announcements to connect people, we can also think about how we encourage community activity. Certainly with the National Foundation for Infantile Paralysis campaigns, as well as community-level activities like the Mother's March on Polio. Nowadays, it's just so much easier. And we can think about the role, especially of social media during this crisis. The creation of groups, for example, to discuss how to teach online. The role of TikTok in allowing regular people to upload videos. We can also think about YouTube and how people can voice their experiences and then share those with others as well. Or, of course, our online technology that allows people to still teach and connect with even large classes all at the same time. Media outlets also serve as spaces for regular people to advertise, particularly the jobs and services that arise during a time of crisis. Now, in addition to needing more florists, postal workers, perhaps grave diggers and coffin makers, we've also seen people use these outlets to advertise their remedies to make a profit at a time of crisis. This stretches all the way back to the 18th century, but currently is still used with promises that things will kill the coronavirus. For example, Alex Jones and his magic toothpaste, or a number of the different essential oil social media ads at this time. Finally, we can think about how media products document a historical moment so that people in the future can look back and understand what different people were feeling and experiences of it. So my question is, what are we going to think about this pandemic? When it is over, when the cases have dwindled, how will it be remembered? Will it be remembered for the Corona beer memes, at least early on? Or the toilet paper shortage and the hoarding of different supplies? Will we remember it for the stigma and discrimination particularly against people who of Asian descent? Or of the myths about what would possibly cure coronavirus or keep it away? Right. Will we remember this as the time that we all rapidly shifted online? And how we could do this, how the effect on professors, the effect on students, or the effect on parents as they unexpectedly had to homeschool children. Will we remember this as the time of tragedy that it is? Thinking about those who passed away as well as those who survived. What stories will be told? And what stories will be preserved and then conveyed? Or will we remember the helpers, both the health professionals who took care of the ill, or the many, many, many different people that provided food and supplies or entertainment, even if it was just for a moment reading a story? Right. What story will be told of the coronavirus experience?